Hi, my name is Jami. I'm a care coordinator, and in the past 3 years, I have been fortunate enough to work for Catalytic Health Partners. I feel like I've made a huge difference in our members' lives. I know that we can't help everybody, but every interaction with a member might leave them with a little bit of hope. And for me, that's really important, that they know that there's somebody out there that cares and wants to listen to them and try to see if we can offer some assistance. So Catalytic Health Partner team, we don't want to take over the care of primary care doctors. We want to work with them to make sure the members are taking their medications properly, make sure they're getting their refills when they need them. And then because doctors don't have a whole lot of time to see a patient in the office, we can see where the patient lives, we see how they live, we see who they interact with a lot of the time. Because there's people coming in and out of the house during our visits, and it gives us a little bit more insight on the actual person than I think primary care doctors get to see. They do know their patients, and I certainly appreciate everything that they do, but I think if they don't mind working with us, we can say, this member probably needs a little bit of extra TLC, and we help them get a more complete story of the patient outside of the office. One of the things I find most fulfilling with this job, even though there are days that are very hard and sometimes we think, oh gosh, I'm not going to be able to help this person, something will happen or somebody on our team will offer a bit of advice that we can use in our day-to-day job. But to know that the member is thankful, they say to us, you have done so much for me. And it doesn't just mean that one care team member has done so much. The whole team does so much for them. And when they say, I just appreciate that you took the time to talk to me today. And that makes it so much more worthwhile to be a part of. Just to have somebody, sit and listen to a member who might not be having a very good day. And it's extremely fulfilling to know that we've helped somebody. Even if it's only one person out of 10, it is one starfish in the sea that matters. I know that we have changed some lives with our members. They are constantly saying to us, oh, I don't know where I'd be without Catalytic Health. I didn't know that I had these resources available, but I know that the whole team really cares about each member that we go and see, whether they're homeless or they're just out of work for right now, or they've hit a really rough patch and don't know how to get out of that hole. And I just feel like when they look at us and say thank you, I know they truly mean thank you, the whole team, for what you have done to help. I worked in a primary care office for many years, and I feel like it was kind of a conveyor belt. Get the people in, listen to their issues, give them a medication, and move them out the door. With this, if we need to be with somebody a little bit longer because we can see that they're struggling, it's okay. The next member does understand if we're a little bit late, but those few extra minutes might be all it takes from saving somebody's life if they are thinking about suicide or they're just ready to give up. Those few extra minutes just gives them a chance to say, oh, okay, somebody really does care about me. Somebody is concerned with how I'm doing and if they're safe, and that's most important.